All right, let's talk about something that's really important for so many families. If you or someone you care about is dealing with Alzheimer's disease, chances are you've heard the name Donepezil, or maybe its brand name Aricept. Today, we're going to really dig into how this common medication actually works. So here's our game plan. First, we'll cover the basics. What is this stuff? Then, we're diving right into the brain to see the problem it's designed to fix. After that, we'll see how it boosts the message, get into the nitty-gritty of daily use, cover the risks, and finally, zoom out to see where it fits into the bigger picture of care. Okay, first up, what is Donepezil actually supposed to do? Now, before we go a single step further, we have to get this one thing crystal clear because it's absolutely crucial. Donepezil is a tool to help manage symptoms. It is not a cure. It doesn't stop or reverse the disease. Knowing that right up front is key. So, its entire goal is to offer some relief from the symptoms. By helping with things like memory and thinking, the hope is that it can make daily activities a little easier and maybe, just maybe, help a person hold on to their independence for a bit longer. All right, so to really get how Donepezil helps, we first need to pop the hood and take a look at the communication breakdown that's happening inside the brain. I want you to meet the star of our show, acetylcholine. Think of it like the brain's text messaging service. It's this vital chemical messenger that nerve cells use to talk to each other, especially in the parts of the brain that handle memory and learning. Now, in a healthy brain, this whole system runs like a well-oiled machine. A message gets sent using acetylcholine, the next cell receives it, and then a little enzyme comes in to clean up the leftovers. This preps the line for the next signal. It's a really beautiful, balanced process. But here's the problem in Alzheimer's disease. The brain cells that actually produce acetylcholine start to die off, and this creates a serious shortage of that messenger chemical. All of a sudden, that vital communication system starts to fail. So, if the brain is running low on this critical messenger, what can be done? This is exactly where Donepezil steps in. Remember that enzyme I mentioned, the one that does the cleanup? Well, it's called acetylcholinesterase, but let's just call it the cleanup crew. Its job is to break down acetylcholine. And normally that's great. But when you're already low on acetylcholine, this cleanup crew is suddenly too good at its job, clearing away the precious few messengers that are left. And this is Donepezil's genius move. It's what's called an acetylcholinesterase inhibitor. Put simply, it gets in the way of that overeager cleanup crew and basically tells it to take a break. And the result is actually pretty elegant. By blocking that enzyme, Donepezil lets the limited amount of acetylcholine hang around in the gap between nerve cells for a lot longer. This gives the signal a better chance of being heard. You're effectively boosting the volume on a fading signal, helping to patch up that broken line of communication. Okay, that's the science. Pretty cool, right? But let's shift gears and talk about what this looks like in real life, the practical day-to-day stuff. For this medication, the mantra is start low and go slow. A doctor will usually begin with a small 5 milligram dose once a day. Then, after about a month or so, if everything's going okay, they'll likely bump it up to 10 milligrams, which is kind of the standard dose. Much later, for some people with more advanced disease, a higher 23 milligram dose might be an option. So here are a few handy tips. The good news is it's just a once-a-day pill. You can take it with or without food, doesn't really matter. A really common strategy is to take it at bedtime. The idea is to hopefully sleep through some of the potential side effects like nausea. Now, there's a flip side. If it causes vivid dreams or keeps someone awake, the doctor might say, okay, let's switch it to the morning instead. And of course, with any medication that's powerful enough to help, it's also powerful enough to have risks and side effects. This part's really important, so let's walk through what you need to watch for. The interesting thing is that the side effects are totally predictable. Because Donepezil boosts acetylcholine everywhere in the body, not just in the brain, you can guess where issues might show up, and by far the most common place is the gut. We're talking about things like nausea, diarrhea, and maybe loss of appetite. These are really common, especially when first starting the medication or after a dose increase. You might also see things like muscle cramps, some dizziness, or headaches, and yeah, those sleep issues we just talked about. Now for the big one, the most serious potential risk. Part of acetylcholine's job is to regulate the heart and slow it down. So by boosting it, Donepezil can sometimes slow the heart rate too much. This condition is called bradycardia, and it can actually lead to fainting. This is a huge deal, and it's exactly why this medication has to be used with extreme caution in anyone with a pre-existing heart condition. It's also so critical to know about drug interactions. Some common medications, like certain over-the-counter allergy meds, actually do the exact opposite of donepezil. Taking them together is like hitting the gas and the brake at the same time. You cancel out the benefit. And worse, if you combine donepezil with other drugs that also slow the heart, like beta blockers, you seriously increase that cardiac risk. All right, let's bring it all home. Let's step back and put all this into perspective and talk about realistic outcomes. When you look at the clinical studies, the measurable benefits of donepezil, like seeing a stabilization in how someone is doing, typically lasts for about 6 to 12 months. After that point, the underlying disease, which has been progressing all along, usually continues its course. And this right here is the crucial takeaway. That 6 to 12-month window might seem modest on paper, but for a patient and their family, it can be incredibly meaningful. It can mean a period of better quality of life. It can mean a lighter burden for caregivers. And most importantly, it can mean more precious time. So at the end of the day, is donepezil the right choice? That decision is always complex and deeply personal. What we wanted to do here was give you a starting point. But the most important step is having a really thorough conversation with a doctor who can weigh all the potential benefits against the risks for an individual's unique situation.